Hi everyone, and welcome to another AMA session with Dr. Ben Behnam. I'm Dr. Behnam, board certified dermatologist and founder of Happy Head. Welcome to our Instagram as well. So this is the Happy Thanksgiving AMA session. Welcome, guys. Before we get started, I just want to read you off the disclaimer. I want to remind you that this information is for educational purposes only and is not meant to provide any medical advice or services. Please do not rely on this information to make any medical decisions, and remember to discuss risks and benefits with your own doctor before starting any treatments. And this does not establish any patient-doctor relationship. So, guys, as you guys know, I'm Dr. Ben Behnam, board certified dermatologist. I was one of the co-founders of Happy Ed, which is an online telehealth platform dedicated only to hair loss. So we're going to go through some of the FAQs of hair questions. And if you're online, you can also ask me some questions as well. So what causes hair loss? So there are many different reasons why people lose their hair. Genetics is definitely a strong a component of that. A lot of patients are genetically predisposed. So when someone comes into the office, and they complain about their hair, one of the questions I ask is like, how does your mom and dad and grandparents look like? Because if your dad is bald, mom is thinning, uncles are bald, and grandparents are bald, you're more likely to start thinning at a young age. So, but also sometimes we have patients that no one is bald and no one's thinning in the family, but they're still thinning. And the reason is because it's still genetics. You probably just got some of those genes that all came together from both sides that basically, is making go bald or go thin. So genetics is the main cause. Number two, stress is also another main reason. When you go through stressful events, it actually accelerates your underlying genetic predisposition to hair loss. So, and stressors could be, for example, abortion, uh, hospitalizations, car accidents, rapid weight loss, you know, kids going to college, tuition 100,000, things like that. Those things could make you basically lose your hair. Also, endocrine, by that what I mean hormones, so if you go through menopause, that could cause your hair loss. If you stop your birth control pill that you've been on 20 years, that could cause hair loss. If your thyroid basically is out of order, or if your vitamin D or iron levels are really low, those could cause hair loss as well. And also there's something called telogen effluvium, where you could go through like traumatic events, like a really bad car accident could cause, a hair loss, or going through divorce, with so much stress could cause hair loss. So a lot of those could, so these are some of the things that could contribute to hair loss. Is hair loss hereditary? The answer is yes. It's genetics. If you're not genetically predisposed, technically, most people are not going to lose their hair. So yes, hair loss is genetics, and then you have all those stressors and what you eat and your hormones kind of all added on top of it. Does diet affect hair loss or hair growth? Yes, it does. Basically, what you eat is what you are. So let's say that if you drink a lot, you eat a lot of processed foods, you smoke, all those basically will contribute to a bad hair journey. So when patients come in, we review the diets, So for example, if doing creatine or vitamins that are high in arginine, leucine, isoleucine, valine, we get patients off it. If you're doing whey protein isolates, we get patients off of them. If you are if you're smoking a lot, we discourage you to smoke. Like, we don't do hair transplant on patients that are heavy smokers, because when you smoke, it basically constricts the blood flows to the scalp, and basically that will contribute to hair loss. So a lot of drinking basically could diminish some of the vitamins necessary for hair growth. And let's say you're a female and you have heavy periods, so which means you're losing like a lot of iron and not taking iron supplements, that's going to contribute to hair loss. So your diet is very important for your hair. What are the different type of hair loss? So there's several different type of hair loss. So the one that we're commonly familiar with is what's called androgenetic alopecia, which is male or female pattern hair loss. Now you have to realize that guys, males, lose hair in a different pattern than females. So when a female comes in, typically they're losing hairs basically on what's called on the top of the scalp right here. This is where they thin out, and basically they're maintaining the frontal hairline. Um, when guys come in, they're losing the hair. Typically, you see the widow's peak going further back, and they're going to lose hair in the crown area. So majority of the time, that is Those are the patterns of hair loss. So that's androgenetic alopecia. And then there is alopecia areata. So I have alopecia areata, which is an autoimmune condition where the body attacks the hair follicles and basically shrinks the hair follicles. So that's alopecia areata. There's also what's cicatricial alopecia. Cicatricial alopecia is what's called scarring hair loss, and there are many different versions. So, CCCA is a very common version that happens at crown area in African Americans, females. And then you also have LPP, which is like lichen planopilaris, which is basically talking like a scar hair loss that starts in the front of hairline with basically sympathetic eyebrows. Scarring hair loss are tough to treat. I mean, obviously they're very difficult. There are reports of PRP, topical minoxidil, like Rogaine, things helping out, but those are tougher to treat. But in order to really figure out what type of hair loss you have to see a dermatologist. And on the Happy platform, we have real board certified dermatologists examining your photos of your hair loss. We don't have PA, we don't have like doctors that are not hair specialists. We have dermatologists who are doing this. And dermatologists go to school for many years to really learn all this different type of hair loss and different causes. So we're really better at it at tackling the hair loss issue, honestly, than any other profession. And at Happy Head, we don't compromise on the doctors we use. We use basically board certified dermatologists to really evaluate you so that we get the right diagnosis, so we give you the right treatment. Um, does the frequency of washing hair affect the hair loss? Well, we typically tell patients not to wash the hair like every day with shampoo. So we typically tell them like to do it every other day. In my opinion, shampoos have a lot of chemicals in it, so I don't want you to use basic shampoo on an ongoing basis, on an everyday basis. Um, Somebody asked, is it okay to use the topical even though I'm not taking a shower every day? Absolutely, yes, that's not a problem. We could just apply the topical on. That is not an issue at all. Um, and then what and another patient says, so do I need to see a dermatologist for my hair loss? Yes, dermatologists are the ones that we learn about hair loss in our residency. This is where we get trained, and this is where we spend the most amount of time learning about the different type of diagnosis and different type of treatment plans. We do biopsies and we look at a lot of those biopsies under pathology during our residency programs. So we not only we see the patients clinically, not only we learn about the different various options, how to treat the patients during the clinical experience, but also we look at a lot of these cases on the pathology and examine it. So we know the patient literally clinically and on pathology. So we have a much deeper understanding than other doctors because this is what we specialize in. So yes, so if you're experiencing hair loss, seeing a dermatologist is the person to one, get the correct diagnosis, and two, to come up with a correct treatment plan is really the best thing to do. We and Happy It, we're really trying to again focus on you having the correct provider and not compromising the provider for you guys. Um, so the stress-induced hair loss may reverse. In some cases, it could be. I mean, it all depends. The earlier you address the underlying stress and you get treatment for the hair loss, the better it's going to be. How does iron deficiency contribute to hair loss? So there are the three main vitamins you need. One of them is the entire vitamin B6 and B12. So that's important. But more importantly, vitamin D and iron are very important basically to make hair. So if you're losing or missing one of those components, then you can't really, make good hair. So I will give you an example. Let's say you want to build a house and you have a lot of workers there to help build the house, but you have no bricks. You can't build the house. It's the same concept with hair. If your body wants to make new hair and you don't have the essential ingredients of making that hair, like vitamin D and iron, you're gonna have basically poor hair growth. Is rapid heartbeat a side effect of hair growth medication? Yes. So there's a medication called minoxidil, which comes in a topical as well as oral version. And oral minoxidil, and even sometimes topical, could lead to heart palpitation, which means basically rapid heartbeat. Can I take both oral and topical medication for hair loss? Absolutely. Yes. Combining both topical and oral medications could lead to much better hair growth. So traditionally, most dermatologists only did one or the other, but In my clinic, and I happy it, we do encourage patients to do both as long as there are no side effects. This is a concept called sandwiching. You're basically, when you take something internally, it goes from the inside and basically affects hair follicles from the inside. When you apply something topically, it has also this local topical effect. When we started Happy Head and we came up with this concept, really a lot of doctors really didn't quite understand it. And that has become a kind of mainstay therapy. So using both oral and topical will give you better results. Is it more effective to leave the topical on your scalp overnight and rinse it off in the morning? Yes, typically yes, but also let's say you put the topical medication Happy at 7 o'clock. You could practically wash it off by 10 p.m. and you're still gonna see very good results. So if you don't want to sleep with it, you could just wash it after a couple of hours and you'll still be good. Um, how is Happy different from other solutions on the market? Very good questions. First of all, I don't know if most people know this, but Happy was the first nationwide distributor of topical finasteride in the US market back in 2020. I mean, a lot of other companies came about 2 years after, but we're really the first ones. And we really tried to lead the pack because we tried to come up with products that were outside of the box for the time and that gave patients really good results. So, and what really sets us apart from other companies is that we're innovators. We're the ones that are always thinking of trying to combine multiple different ingredients and random ingredients together to give patients the best results. But more importantly, we are customizable. And what that means is that you can adjust the ingredients in the formula based upon your hair needs. In other words, all other companies have one product, for example, one product here, and they make the same product for everyone. But if you have an issue of your hair loss a little bit different, you can't change that. At Happy, we're different. This is a customizable formula, which means let's say that the minoxidil in the formula is irritating you. You give us a call, you talk to one of our hair specialists, and we either lower the minoxidil concentration or take it out. No other company really caters to patients like that. We are adjustable, personalized, customizable formula for you, which means the ingredients in this bottle changes based upon your needs. We don't have 20,000 bottles sitting on a shelf and that we're giving the same bottle to everyone. We don't do that. We make this bottle for you every month based upon your needs. And let's say if you have one formula and you don't like it, we will adjust it for you free of charge. So that's really what really sets Happy apart from other companies. And honestly, it's a lot of work that we put in, but it pays off because you are different and you are unique as a patient. And if you're gonna get a better hair growth by us customizing it, that's what we're here for. Um, I'm a young female. What is the recommended for my hair loss? So obviously, everyone's different, but there are typically three oral medications. There's oral finasteride, oral minoxidil, and oral spironolactone. In my opinion, oral spironolactone is it's not that great. I mean, it's okay, but all not that great. Number two, I mean, it just doesn't do a very good job at basically causing hair growth. Number two is oral finasteride. We typically don't give oral finasteride to females below age 50. And number three is oral minoxidil. I'm a big fan of oral minoxidil, especially for young females. Again, one of the side effects it could be that it could lower the blood pressure, so that's something that you have to be careful and talk to your dermatologist about it. And then there's also topical treatments. There's topical minoxidil, topical spironolactone, and those could actually be effective. And I'm a big fan of topical minoxidil actually. What is dutasteride and why is it better than finasteride? So finasteride is an FDA approved medication for hair loss. It inhibits an enzyme called 5-alpha reductase, one of them, and 5-alpha reductase is responsible for converting testosterone to DHT. So by inhibiting that enzyme, you reduce your DHT production, and it's been shown that by inhibiting one enzyme, you reduce DHT production of about 70%. Then dutasteride is a medication that used for prostate. It is used as an FDA approved medication, but it's used off label for hair loss. It inhibits two enzymes, 5 alpha reductase 1 and 5 alpha reductase 2. And both of these enzymes are responsible for to turn testosterone to DHT. DHT is what's going to cause hair loss. And in clinical studies, it's been shown that dutasteride inhibits about over 90% of DHT production, whereas finasteride is inhibiting about 70%. So dutasteride inhibits more of DHT production, it's inhibiting two enzymes, and if you look at clinical studies, dutasteride did a better job at causing hair growth than finasteride. So this is why we love dutasteride more. As I said at the beginning of 2024, 2024 is the year of dutasteride. This is it. And 2025 too. I think it's even a bigger year for dutasteride. Patients see better results. Really, that's what counts at the end of the day. So about the side effects profile, they're about the same, and there is one report that indicated that dutasteride could have lower side effects. So with respect to sexual side effects, but in my clinical practice, I definitely have not seen more side effects with dutasteride than finasteride. What is liposomal? Liposomal is a slow release formula. It's for topical only. And it is used basically for, we have a liposomal finasteride, and it is used to reduce the risk of sexual side effects. And the way it works is, since slowly releasing the finasteride, you only use it once a day, and more importantly, it reduces the risk of certain side effects and slowly going there. So is finasteride liposomal better than topical dutasteride? That's a very good question. Um, I think we have never done studies on it to compare the two. Well, the question is, what are you defining as better? I think topical dutasteride could work more effective, could be more effective than the liposomal finasteride. But the question is, can the liposomal finasteride have lower risk of sexual side effects than the topical finasteride? Now we know with topical finasteride has a bigger Dalton, it's a bigger molecule, so it has a harder barrier to penetrate basically through the blood-brain, through the into the blood, into the capillaries. But that study has not been done, so I cannot really comment on that. How is liposomal made? Is a special formula that basically again is a slow release formula that's really happening, but it's very difficult to make. And right now we have the liposomal finasteride minoxidil formula out there. How does the finasteride and dutasteride react differently in men and women? It really doesn't react differently. The only thing is that we don't usually try to give it to females below age 50. Do you remember your best success story? Yes. So I had a young gentleman who had tried oral finasteride and had sexual side effect. He was probably 21 or 22, and he had honestly given up hope. He had lost a lot in the crown area, and he was really upset. So we tried the topical happy finasteride formula, and he did dermal rolling as well, and was really religious about it. And he actually saw a lot of hair growth. And when he literally came in, gave me a hug, and he told me that really happy and has really changed his life. So, and honestly, there are a lot of countless stories like that. I mean, look, we have the products being used by tens of thousands of patients on the monthly, and I tell you, we have really reached in a very positive way reached a lot of people's lives, and like in a good way. We're contributing to their lives in a good way. So that's I'm very happy to hear that. We encourage everyone to take progress photo to really document your hair growth, and that's really important. And you could actually upload your photos online on your account page by clicking on the Photos tab, and then we could keep a track of it. I think we should have like a prize or a giveaway for people that upload it. No, people that reach out to us, I talk to them for testimonials. Yeah. We do testimonials. We'll work on something more exciting though. But we're gonna try to come up with something more exciting. Um, Black Friday Cyber Monday deal, guys. You can get $120 off your first dutasteride purchase for this Black Friday, topical and oral. And again, I truly believe that patients that see the best results are the ones that do oral and topical together. So that bundle is really, really effective. Now let's talk about the application. We don't have any of the topical. Okay, so again, so how do I apply my topical treatment? So the way it works is that it comes in a dropper. Just do one pump and apply it on your scalp. How do I do the oral and topical at the same time? The key is to titrate up slowly with the oral and topical, so that you don't get like a shock to your system. How often should I derma roll? I mean, if you use a 0.25 derma roller, you could actually derma roll every night. Derma roll. Can I apply the topical to damp hair? Absolutely. Do I do topical first and derma roll? Yes. I mean, there's no real correct way, but if you apply the topical first and gently dermal for 10 seconds, that's probably the best way of doing it. Does taking the medication at the same time every night really matter? Well, look, I mean, it doesn't have to be exactly 9:21 every night. Just take it whatever you want. You know, what happens if I miss 2 weeks of treatment? Nothing bad happens. Just get back on it and continue. So, account page information. So, Happy is a subscription service. We make it very easy to track your treatment and progress. You could definitely go online, and there are a lot of self-serve options online. So you could request to adjust your frequency. You could change the refill dates at any time. We basically cater to you. And now you can even upload your photos online and track it online as well. It's actually really important to track your progress because I think a lot of patients just forget how they used to look. Happy assigns you a board certified dermatologist, and you can contact them via HIPAA secured portal at any time. Remember, we offer a lot of different products for our patients, and literally ours is customizable. Um, Ours is customizable, and we have about 200 different SKUs. One of my patients asked, "What do you think of RU58841?" So that medication has been around for a while, but it's not FDA approved, so it's really hard to really make a judgment call on it. Again, guys, thank you so much for tuning into Happy Ed. I'm happy that you guys are a Happy Ed fan. Please give us a review on our Trustpilot page or Facebook page. We really would appreciate it. Again, we have a team of hair specialists that are here to answer your questions. You could literally get on a call with them or schedule an appointment. Visit happyed.com/help to chat directly with one of our agents. And guys, happy growing. And again, happy Thanksgiving. Thank you, Francesca, for making everything happen here. And we wish you guys happy Turkey Day. Bye, guys. Have a beautiful day. Enjoy. If there's any questions, please reach out to us at happy.com. Have a nice day. Bye bye.
Beautiful.